Go. I'm ready to go live, going live. Now it's going to open somewhere else, and I'm going to mute myself.
Oh, yeah, I need to mute the YouTube.
Okay, we are live.
Okay, we're live. Oh, no, the site's muted. All I kept thinking about yesterday was, the theme song to... No, that's it.
What?
Those are my crutches. Good morning, everybody.
Good morning. This is the kind of start we're having today.
Yeah, so I kept thinking about in Full House, the wake up, or the news anthem for the morning report, the morning news that Becky does.
Oh, you know what? I don't.
You've
think
never
I've
seen
watched
Full
it.
House? Wow, I cannot believe. So anyways, that's
I'm
just
sorry
been
to
in my
disappoint
head.
you.
It's okay. I'm usually the disappointer when people ask if I've seen certain movies and stuff, and I'm just no, and then I always get the what reaction.
Yep.
So this time I get to give it out.
Yes. Dish it.
Yes. So hello to people who are here. If you're here, feel free to say hi or be a lurker. Tell us where you're watching from. Oh, I was gonna say, I hope my mom's audio does not get picked up by this. I might need to close my door.
It'll be what it is.
I know, because when I stream, I have to close my door because it'll pick up everything that's going on out there.
Everything.
So, yes. Okay. So, how have you been,
up, Bella? I'm a little distracted by the book on your bed, and I'm trying to figure out what it is.
It's Ugly Love by Colleen Hoover, the popular Colleen Hoover. So I can't really tell you. It's because it's one of those books that jumps back and forth between times. So like it's present and then 6 years ago. But at the present, it is about this girl who's a nurse who moves in with her brother who's a pilot. And he has like this really handsome pilot friend that lives across the hall. And they're like super attracted to each other. But he's like, I have 2 rules. Don't ask about my past. And hello, Bigfoot.
Hey, Bigfoot, thank you. We know we're live. We're glad you're here. We're talking about the book on Bella's bed.
Yeah, that one back there, which matches my chair. But he's like, I only have 2 rules. And it's like, don't question me about my past and don't expect a future with me. And so the girl's like, oh my God. So that's about it. I don't really know. And he hasn't had a relationship in 6 years. So since I guess the last one. And when this nurse met him, he was actually drunk and he was like saying some other girl's name and was like, I'm sorry. So it kind of just, a little like what happened kind of book that you want to keep reading to. Yeah.
Sounds very dramatic.
Yeah. It's dramatized for fictional purposes.
Dramatized for your enjoyment.
Yeah.
Hey, Bigfoot, glad you're here. Where are you joining us from?
Oh, my coffee. Excuse me.
Oh, get that coffee.
Okay. Okay. It's very full. There's just like no space for my milk. That's why I was like, oh. Okay. Has anybody had the pumpkin spice latte yet? Yay! Oh, I'm so proud of you.
Thank you.
It's one of my best friends and I have it. Did you already put milk? Oh, one of my best friends and I have a tradition where we take a picture together every year when the pumpkin spice is released. So we missed ours last year. And we're gonna take ours this year. But I even have a non-dairy Starbucks pumpkin spice creamer.
Wow.
You can only find it at Target.
Huh, good to know.
Pine Mountain, Georgia. Come visit.
Yeah,
I have never been to Georgia, but the conference next year is in Georgia. Atlanta. Or not next year, 2 years. Our VEDS tour.
Yeah.
We should get that going.
Oh, yeah. We're going to talk about why Bella has crutches today. We are going to talk about that.
I mean, should we just jump right in? I have a very long health update for you guys.
Yeah, why don't you start with it?
Okay, so I was actually doing pretty well at our last live. And then I regressed as far as COVID symptoms and calf muscle. So I got COVID from the Marfan conference, which we talked about, which was mid-July. And then I also had an angry calf from then because we were, walking, standing a lot, and just kind of in general on our feet. There's a big delay in that. Yeah.
Sorry.
I know. But yeah, that's why sometimes if we just pause, it's because we're waiting for the chat to catch up with us. I feel very ADD today.
Yeah,
so
me too. I mean, I was messing with my lighting 2 minutes after we were supposed to start. So
I know you guys should have seen them as Katie and I were in.
Can't get it
my
right.
mic was falling.
It was hilarious. I wish we had that on recording.
Yeah. So anyways, yes. So I was in the boot for a week. And for those of you who don't know, I have been dealing with a calf muscle tear in the left leg that has been healing and tearing off and on since 2016. So nothing out of the ordinary with this. I just, whenever I feel a little angry, I just put the boot on. That way I take some weight off of it and then it heals. So that's what happened this time. I put the boot on, I healed. I took the Paxlovid. I was feeling better from COVID. And then I really don't know what happened as far as COVID goes, but I had a really bad Charlie horse cramp in my calf. Did that happen already the last time that we were on live? I don't think so. I don't think it did, but I'll just say it again. But one of those really bad calf muscle cramps that hurt and you feel like your leg is going to fall off, or you just want it to fall off because it hurts. After I got one of those, I couldn't walk on my calf again because it was in my bad calf. But I kept walking because, I thought it was just pain from the cramp. And then I got to a point where I couldn't walk at all anymore. I couldn't put my weight down on that leg. I couldn't even stand on my tiptoes. I couldn't even wear the boot because the pain is right behind the knee and the boot goes to just below that. So it was just very tender to touch, to even just not be doing anything. So I scheduled a visit with my primary care, who's also a sports medicine doctor. And he said he felt a tear. He literally felt around the calf muscle and he was like, yeah, I feel a small tear there. And the interesting thing is this time around, it hasn't bruised and it hasn't swelled, but it's a new tear. So I don't really know, but he said that I can't use the boot because it's not supporting that area. So I'm in crutches or wheelchair for the time being. So I tried to do the boot. Can I have Mama? Can I have something to stir the coffee, please? To mix the coffee. What was I saying? Anyways, that's why my mom's here, because she has to be my arms, my arms and legs, because I can't do much. I can't carry coffee with the crutches. So
how long do you have to be in crutches? Do you know?
I don't know. It's really just until my leg starts feeling better. And so my doctor ordered an MRI because he was like, we can get it covered with the insurance because this is not a recurrent calf muscle tear. He's like, this happened after a muscle cramp, and therefore we should be able to get it covered with the insurance. So I had my MRI last Friday, not yesterday, but the week before. Oh my God, I have a story about that too. I'm telling you, I have a lot to talk about today. So the MRI showed that I have a 10 centimeter long tear. It's not in the calf muscle, it's in the soleus muscle, which is deeper, under the calf muscle. And then it also showed that it's not a full tear, but it's a little tear in a little bite size, of the muscle, a little indentation.
Took a bite out of your muscle.
Yeah. That's what the tear looks like, not full on separation, but there is separation. So it showed that. And then it showed that I have a lot of scarring in the calf muscle and the tendons, in that surrounding area. So my doctor thinks that because of the scarring that I'm having these recurrences, which makes sense because I think that the, scar tissue doesn't move well, like normal tissue. And it's straining my native tissue, my normal tissue, and it's causing it to tear. So yeah, that's what's going on with that. But my doctor did suggest something called PRP treatment, and I was Googling it, and it's plasma. I forgot the R stands for. Plasma something treatment. PRP. Plasma.
I want to say radioactive, but I know
Not
it's
plasma.
not it.
Platelet are
Restoration.
platelet are plasma treatment. Maybe something along those lines. But anyways, what it involves is they would draw my blood and separate the platelets, and then they would put that into a shot and inject that into like the area around my
That
calf
sounds
muscle.
so cool.
And it's supposed to like stimulate the tissue to heal. And it looks like it's, I don't know if it's I would say a new technique, but it's not covered by insurance yet. It's used for a lot of athletes. I'm really considering this. I know that we're told a lot with VEDS, we can't have any invasive treatments or procedures because of the risks with our fragile tissues. But I'm actually really considering this because I think it's better than surgery, right?
Yeah.
Better to
Is
try
that
than a
super
surgery.
invasive? I mean, don't they just like put a needle in there or what?
Yeah, they would just put a needle in there. So it's just like getting a shot that we get, for vaccines and stuff. The thing that I'm concerned about mostly is the bleeding or, rupturing a blood vessel, because even when I've just had blood drawn, they just literally stick it in there. It's ruptured a whole vein. So that's the one thing I'm concerned about. But yeah, we're gonna ask around. He wants it cleared by one of our VEDS specialists first, for sure. So I love that about him. And yeah, we'll see. Oh, it's platelet rich plasma injection. Platelet rich. I never would have guessed that.
Nope. I was like restoration.
And I'm like, yeah, that sounds right. There we go, back to not knowing words. So yeah, we'll see if that happens. I also have a hematologist, so I definitely want to get it cleared by them also, which I think, we've talked before. I have a hematologist because of my von Willebrand's diagnosis, but I also really think having one helps with the VEDS diagnosis. I think they're a good person to weigh into because we also are at risk for heavy bleeding and, something that the care team should be aware of. So yeah. That is.
I hope that PRP treatment gets covered for you and that you're able to.
Yeah.
I'm so interested to see.
Yeah. And I really like it. So my doctor he's a sports medicine doctor and he works for like the Houston Texans. And I think it's really cool. Like he probably does this with the athletes. I'm basically a Texan.
If it works, like, does that work on like older injuries to help restore tissue?
I have no idea. That's a good question.
I've got some scar tissue, I guess, inside from falling down the stairs a few years ago.
Yeah.
And I had a nice giant hematoma from that. And so the tissue has kind of like depressed in that area. And the doctor said that that's scar tissue inside and there's nothing I can do about it. I'm like, oh man.
Does it look like a dent? Like a that's how
mine looks like a dent.
I didn't know you had a dent. I have a little one in my butt too from when I had my colon perforation, they had to insert the drain in there. So it was like the drain, I would say it was like this big. Just,
it dented.
It dented. We're like used cars.
I was just thinking that too. I'm like, you can't just like blow it out like a dent though on a car.
Imagine looking at the plunger, the suction on us.
Well, don't they do that for like, I've never done this kind of massage, but for a while there, a few years ago, everybody was like raving about the massages with like the suction cups. And I was like, that seems like the worst idea for me ever.
Yeah. I don't think, I think it would bruise me. I mean, I get bruised from the when you have the EKGs, those little stickers that they put, I get bruised from those. I don't know if you've had any experience with that.
I get little like, just little spots, like little red spots underneath them from when they pull it off.
Yeah.
But other than that, I don't get any problems with them.
Yeah, I actually bruise from them. Yeah, we'll see. I'm really, really heavily considering this because it's been so long. Like I was almost considering surgery too, but my doctor was like, let's try this. So yeah, we'll see. But let me tell you the MRI story.
Oh yes, tell us the MRI story.
So I went to a location that wasn't at the hospital. It was just like an outpatient imaging center. And my doctor specifically ordered the MRI of the calf muscle. So obviously see the soft tissues. Before I forget, I wanted to tell you that I named the dent in my leg, and its name is Nigel.
Oh my
Yes.
We should do maybe the chat can name the dent in my butt.
If you guys want to name
live stream is starting off really strong. I mean,
we're so everywhere.
We are very, very distractible today.
Yes. So okay. Yeah. So he wanted to look at the soft tissue, but he said, I want to order it with contrast because obviously he wants to look for vascular issues given VEDS. So I have an allergy to the gadolinium contrast, which is the contrast used for MRI scans. Iodine is used for CT scans. So I've had no problem with CTs, but one of the times I had an MRI in 2019, 2018, I have had tons since before then and with contrast, but I just out of nowhere developed a reaction to the contrast that they use. I got a couple of hives. I felt the burn a little bit when I got scared because I have had one infiltrated vein before. Have you had any?
I have.
With contrast?
Not with the contrast, but with it was a medical student on their first week trying to get an IV put in.
Oh my God.
It was bad.
Yeah.
Yeah.
And it's funny because whenever that happens, I know it's not their fault.
I was so mad.
Oh, I would be pissed. But I know it's not their fault, so it's hard. I mean, this last time I was in the hospital, I had a nurse putting in an IV and I was telling her that it hurts. And she was like, it's fine. And it bruised. And I thought I was concerned she was getting the tendon.
Yeah.
But I was telling her it hurts and she just completely dismissed me. And it was a big rupture. It drives me nuts.
Yeah. This one, it was she came in with the person training her and was like, this is my first time doing this. And I said, well, not to scare you, but my tissues are really difficult.
Pre or post VEDS diagnosis?
Post.
Okay.
I knew about it and I have a connective tissue disorder.
And you still let the student do
it?
Please
be really, really careful. And then she started doing it and she kept having to poke it and take it out and poke it again. And I'm like, please be careful. Please don't rupture my vein.
Well, yeah, because there they go rupturing everything. And then what can they use?
And then I was and then it hurt so bad. I knew it was wrong. And then they started pushing this stuff in and I just could see it in the wrong spot out here. And I was in so much pain and I was yelling and the guy's like, all right, it's infiltrated. We're going to take it out. And then he did it. And I was like, it's okay. I tried to make her feel better.
Yeah.
And I was also so upset because I was I knew it was a bad idea. I'm not the person for the first time blood draw.
Yes.
Not the right patient for that.
No. Yeah. We had
we got sidetracked from your MRI story.
Yes, we did. I'm gonna forget what story I wanted to say. Oh no, it was just quickly with when I was in nursing school. It's funny. It's good that the student was honest with you because I remember it was my very first day at clinicals and they kept telling us just jump at the opportunity to go do stuff. And so I was like, okay. And so one of the nurses came to the students and he was like, hey, who wants to give a shot? And I volunteered. So I went, never injected into a person. And I'm just I walk in the room pretending I know what the hell I'm doing. And the patient, and it's funny because he phrased the question so perfectly. He was like, do you know what you're doing? I said, yes, I know what I'm doing, but have I done this before? No. So I didn't say that part. So he was comfortable with me. So
how did it go though? Did you rock it?
I did.
Nice.
Yeah. And then the second time, it was with a nurse and she knew I was a student, obviously. And so she was tense and then I was tense. And that one was a painful shot for her. So yeah, that one was not fun. But she was like you, it's fine.
It's fine. Don't worry about it. It's okay. You'll do better the next time.
Okay. So yes. Okay. So back to the contrast. So I developed the allergy. It was one-time allergy. I don't know what's going to happen to me next time I get it, if I get it, but now I list it as one just in case. And I list it as one because if I'm nonverbal or like unconscious, I want them to see it in my chart and know that they have to be cautious with giving this to me. I don't, I didn't have any like pulmonary symptoms or swelling or anything. So he ordered it with the contrast and he was like, let's just take Benadryl an hour before. So we're like, cool. So my mom and I, she bought some Benadryl and it started off rough already because in the morning the day before they did like the little screening questionnaire of like, are you claustrophobic? Do you have any metal and all that stuff? And I had an earring in my cartilage that I had not been able to take off. Like it was not a normal back. It's just like a solid, like this is the earring end. Yeah. And then the earrings like this. So I didn't know. I was just like, I have this, but it's in the calf. So maybe we'll be okay. Like,
yeah.
And I was feeling sick on top of it all because I had the COVID symptoms. So I was like, I don't feel like going to a tattoo place right now to get this earring removed.
Oh, because then they come in too with the little pliers and it's so scary.
Yeah, I did not want to. I was scared. I've been terrified of this. So then they called me Friday morning, which was the day of the MRI. And they're like, so we can't do the MRI if you have that earring in there. You can't, like, if you can't take it out, we just can't do it. And I was like, but it's in my calf. And they're like, she was like, the whole room is magnetized. And I was like, okay. So the next opening wouldn't have been until the next week. And I had already waited over a week for this. So I was like, she said that they had one later Friday. And I was like, okay, I'll just take it. I'll see what I can do. If I can't get it out, we'll cancel. So I took it. I emailed the tattoo place that I got the piercing. And on top of it all, their piercings are done upstairs and there's no elevator. So I was like,
oh.
So then they were super nice. They emailed me back and they're like, all you have to do is just literally pull it apart. But if you need help, come in. Well, one of our artists will do it downstairs. You don't have to come upstairs. So I did it. I took it off. We're great. Good to go. No other worries. So then we get to the imaging center and they're already like 30 minutes behind with the other MRI. So I took the other book I was reading, which was a fantasy book. I think I like fantasy books now. Yeah. We could get to that later. But I was reading that and then they took me back maybe like 40 minutes after the time that I got there or after my schedule time. And I got there like 30 minutes before. So it was already like an hour. And the tech, like I changed into my gown. My mom's in the little MRI waiting room. And then he comes out and he's like, I see that you have a gadolinium contrast allergy. And I said, yeah, I took Benadryl an hour before. And then he was like, well, I'm just going to have to clear this with the radiologist to see, if we can get it done. And I was like, okay. And the order says MRI with contrast, take Benadryl before. And so after a while, I started like willing myself to the bathroom because I was just chugging water. Because first of all, we have to make sure we're hydrated when we're getting IVs because that helps with them. I've learned my lesson in that. And as soon as I started willing myself to the bathroom, I heard it come out and say, I'm so sorry to my mom. And I was like, are you kidding me? And I was pissed. And I came back and I saw my mom was pissed. So I knew that they were saying that they can't do the MRI. And so he was like, the radiologist said that you have to also take a steroid with the Benadryl beforehand. And I was like, I don't even think I can take steroids because of VEDS. And he was like, well, that's just what he's saying. Like he doesn't want to move forward with it. And so I tried calling my PCP, who was the one that ordered it, and he didn't answer. So I texted him, gave him the rundown of the situation. And then he responded. He was like, I'm on the plane right now. So luckily he was using his Wi-Fi and he was texting me back. So he was like, I don't want you to have a steroid. So I told the tech that I'm like, I can't have steroids. I took the Benadryl. It was just a hive or two the last time. And so he was okay. Let me go tell the radiologists. And then he was like, I'll tell the radiologist. He was like, are you taking any medications that interact with the steroid? I said, no, it's my medical diagnosis, the VEDS or vascular EDS. So he talked to the radiologist, and the radiologist was like, I don't want to do the scan. Basically, like, we're not going to do it.
Ugh.
And then he was like, the radiologist was saying, if your doctor wanted to look at the vascular system, this is not the order he should put in. It's like, it needs to be an MRA or an MRV. And I was like, but he was like, this is to look at soft tissues. And I said, yes,
Yeah,
it's to
what
look
you
at
need the scan
both.
for.
Like, that is what he was like, this is not the right diagnosis to look for, a vascular issue. And it was just like a big back and forth.
That
My
was
mom was
so
frustrated.
frustrating.
I was frustrated. I was like half asleep on Benadryl. And so they're like, we could either go forward without contrast, or you can like reschedule with a steroid. And I was like, what are you not getting?
Yeah.
So then my PCP was like, at this point, just go ahead and have the MRI without the contrast. So I had the MRI, and I basically lost a weekend because I slept the Benadryl for no reason off. I woke up at like 3 p.m. the next day. It was the worst.
That is terrible. That is so frustrating.
It was so annoying.
The communication breakdowns that can happen between the people on the team is just so frustrating.
Yeah. And the poor tech guy, like he was, the messenger bearer of bad news. He was so professional about it. We didn't take it out on him. We were like, we know it's not you. But he was like, I suggest maybe scheduling at the hospital next time. He's like, because they'll be more likely to agree just in case something happens. Yeah. So I was like, okay, well, that's good to know.
Great.
But he was like,
here.
Yeah, bye. You have lost my business. Gonna leave you guys a 1-star review.
Do people leave like star reviews on MRI places?
I think so. I know they do on clinics for sure. I'm pretty sure they leave. People leave reviews for everything.
All right.
Yeah. That's how I found a dentist and found out that the reviews were right.
Talking about dentists.
No.
I'm like going for Invisalign.
Oh.
Yeah. I don't know. I've been really nervous about it because I read online that I don't know. I look online at stuff and I shouldn't sometimes. But that if you have gum recession issues, that maybe it's not the right thing for you. And that's one of the first ways that my VEDS showed up was with gum recession.
Yeah.
I had surgery for it in 2013, and then it came right back pretty much after the surgery. It was like, you thought you fixed this.
Yeah.
And but the teeth have moved since I had braces, just enough to where I'm constantly biting my lip on accident when I'm eating. And then I get like blood everywhere, and it's so frustrating. So it's reached a point where I can't not do anything.
Yeah.
But
yeah, it's one of those things where you get to that point and it's like, do the benefits outweigh the risks? Like this, I'm going to have surgery for this. I need to get that.
What is
it's
that?
getting worse. It's a contracture.
Is that what it's called? Like when they get stuck in a spot or?
Yeah. So what I think happened is I had a blood blister there like 10 years ago. This is 10 years in the making. And it just healed abnormally. Let me see if you can.
Oh yeah.
Yeah, you can see. And it's just healing like all this. It's underneath. It's superficial. Was that the word? I'm in the medical field. And yeah, it's just getting worse and pulling my pinky down. They did x-rays. I've seen derm. Like it's nothing with the bone or the ligament. It's literally just this. And interestingly, I had another blood blister on this finger this year. Let's see. Can you see? And it looks like it's kind of the beginnings of another one. Can you see? It's like a little hard right there.
Yeah.
I don't know if you can see
it, but I can use my imagination.
Yeah. So anyways, the Invisalign. So did you already decide to do it?
I have mentally decided to do it. The dentist did I had a CBCT yesterday, which is like a CT, I guess, that shows all the roots of the teeth. And so they're going to bye, Athos Rock. Thanks for stopping in. Hi, bye.
Hi and bye.
got wrapped into something.
I thought you were
I
saying
know that's
rocked
roped.
into something like a pun.
Hope you have an awesome
Matthews
day.
Rock. I haven't heard that name in years.
Used to watch that guy on Twitch. So they got a CT scan of the roots of the teeth, and the dentist is just like making sure that it's okay to be moving the teeth and that the roots are strong.
Oh, good.
So I'm waiting to find that out, but I'm like mentally, all right, I'm just gonna do it. And I'm so scared about the I asked a couple dentists this, and they're like, I don't know who told you this. It's so ridiculous. But I guess my previous dentist, I think one of the dental hygienists actually told me that I've got this like permanent brace on the back of my front teeth, like
Me
after you get
too.
braces.
Uh-huh.
And she's like, it's a good thing that that's there, because if you ever got that removed, your teeth are probably going to fall out. And I'm like, so they're talking about taking that out to do the Invisalign. And I'm like, but are my teeth going to fall out? Like, please, I'm like really
Who
worried
told
about
you
this.
that?
I think it was one of the dental hygienists.
The
She's like, that's probably
hygienist.
one of the only things keeping that tooth there.
What?
And I'm like, what? Like, I've never had a cavity or anything. I just have gum
Really?
recession. Yeah.
Wow. I think
Like,
I'm all
just have gum
cavity.
recession. You're all
And
cavity?
no, maybe gum recession now. The reason why when you said dentist, I was like, because I haven't gone in 2 years and I need to
Mm.
go. I've just been putting it off because the last time that I went to the dentist, they were super rough. I told them that was a bad review one. I told them that
Did you leave the 1-star review?
I didn't. I'm not. I have to like really be peeved to leave
Yeah.
a review, negative one, and I have to be really pleased to leave a positive one. So I'm not just going and reviewing it, or unless it's like a free donut or something next time you come in. Leave a
A free
review.
donut for a bad review.
So what was I saying? Oh yeah. So
Dentist.
I went there and she said that they needed to do a crown.
Mhm.
And so, we always do the spiel where I'm like, I bleed easily. If we're going to do a procedure, like something major, I need to take my medicine before to help my blood clot, which has to do with the von Willebrand's. But again, I think helps with VEDS. And so she's literally in my mouth, ready to do a crown. She's like, oh, we have to do a root canal. And they just start doing the root canal right then and there. And I hadn't prepped anything. And they were so rough. I was so pissed. Like I left the dentist mad and I was sore for like a whole 24 hours, maybe. So I've been traumatized since then.
Yeah.
But the hematologist that I see here, they actually refer a lot of their patients to a specific dental practice.
Oh, cool.
So I don't even know why I'm putting it off anymore because they'll be familiar. They'll be gentle. Right. But yeah, that I've just been so much other teeth are always at the bottom of my like body priority list.
Yeah, this Invisalign thing I think it's been a problem for at least 4 or 5 years with that one tooth moving, and now the other ones have moved just slightly.
Are they moving like this?
Yeah,
that's how mine is. That's how this one is.
This one is moving out a little bit, and now I have a cross bite between like here and here. And those are the problem teeth now. And so it was like, I even had a few years ago, I had a mucocele right here that I had to get removed. It was before my VEDS diagnosis, but same thing, right? I had started like accidentally biting that lip when I was eating. And then all of a sudden I had this mucocele there and I didn't know that's what it was. So for like 2 months, I was trying to like bite it off myself and it was terrible. And then I had to get surgery to get it removed. And I found out it was because of that. And so now every time I bite my lip when I'm eating, I'm like, oh, I'm going to get another mucocele. And
yeah.
the whole thing.
Was that painful or was it just something that you noticed there?
It was a little painful, but it was mostly irritating because it was like a giant bubble, like a blister, but it's hard. And you could see it. It was so embarrassing. Like you could, because it's where it is.
Yeah.
Like lip and then bump. And I hated it so much. It was so bad. So when I got that removed, they're like, well, it shouldn't come back because they basically like remove the damaged saliva gland when they go in and remove the mucocele.
Oh, so that's what causes it?
Mm-hmm. It's like the saliva gland got damaged by me biting my lip. And so every time.
So it's because that sounds kind of like a cycle then.
Yeah. Yeah. So then you get rid of it you're like, oh, thank God it's better. And then it comes back a few days later and it just basically like refills.
God, everything is so persistent for us.
It is. But, you know, I need to get it fixed.
Yeah.
Because it's just going to keep happening if I don't fix the crossbite.
Yeah. And the same thing with the calf muscle. I think there's two important things with both of these, procedures that we're considering is that one, we both got to a point where we are 100% ready. We're not 99%, not 98%. We have sat about it. We have felt it, and we decided this is what we want to do. Then the second thing I think is important, obviously, is we are taking the time with, to have these conversations with doctors to make sure we are completely informed before going in with these procedures. I think these are really important things for people who have VEDS to always consider.
Absolutely. And like my last remaining fear was my teeth falling out. So for some reason, if the bar comes out and this tooth over here that has the lowest gum line falls out, I will let everybody know. But I have been reassured that bar right there is not what's holding my tooth in.
Is it just like, I only have two pieces of glue, like one here and one here, attaching the wire?
I don't know. Now I'm like trying to feel it with my tongue. Like, how many?
I don't even know how this
glue on each tooth.
Like each individual tooth?
I think so. I don't know.
Also, since we're on the subject of braces, I didn't know you had braces also. How did you handle that? Like, how were they for you?
I don't remember a lot. So I don't remember a lot of bad things, except for I had to wear headgear and I had an expander, and the expander was like the worst thing ever.
My nephew has that.
Middle school. Yeah. And so it was just like they put the key in there and turn it, and it's just miserable. But I think I'm really, really glad I got it because my teeth were they were pretty wild from what I remember.
Yeah.
But I don't think I had problems with the actual like braces in my mouth or anything like that. I think I just remember really like hating the headgear and hating the expander. And once we were done with the expander, I think it was a lot easier. I think my mom's in this chat. So if there's something else I'm forgetting that was important in that I just don't remember because the expander was so miserable, please let us know in the chat.
It outshined every other thing.
Yes, it really outshined every
We should have we should put our moms both backstage, and if we need to weigh them in, we could just put their cameras on. Please consult.
I feel like that's that reminds me of like Who Wants to Be a Millionaire, but like it's like phone your mom.
Yes. Lifeline, please.
Oh, that's funny. So you had braces too?
I did.
How did you do with them?
I think I did okay. I know that they had to pull teeth to make room for it. That I think was the time that I hyperventilated. Before they pulled the teeth, like it got so bad that my hands and my feet started doing this because of the hyperventilation.
Gosh. Yeah.
Yeah. So, and I think it's because they didn't numb me enough. So that was one thing. And then with the braces themselves, I didn't have to have any gear, thankfully, but I did have to get the bands to like pull the bands. Yeah. So that was the most, obviously it's painful for everybody. And then the problem that I had was the cutting of the insides of my mouth. I would get cut up all the time from them. So I was like a very avid wax user, or I tried to be.
I think I used a lot of wax, but I don't remember.
Yeah.
A
lot. Did you wear your retainer?
I did for a long time, and then I stopped, and that's why I'm having this issue.
I stopped like earlier this year or last year. And it's because
a few years ago, but it was like years and years and years after the braces were done. So I was like, it's probably going to be fine. And it's not fine.
That's where I'm Delulu. I convinced myself of a lot of things.
Yep. I was really convinced that it was going to be fine. And so now when I do the Invisalign, I understand that I'll have a top and a bottom retainer. I'm like, I hope that's not weird because I would have to wear it.
Like during the day also?
Well, while I'm doing the Invisalign, I have to wear it like 22 hours a day. So I'll have a top and bottom retainer in.
But they're clear, right?
Yeah, they're clear. They're
I wonder
clear.
how that will. I mean, I'm sure you'll get used to it,
I
but
hope so. I mean, I was
I'm
asking
sure.
them all kinds of questions. I'm like, I use my voice a lot, you know,
Does it
and
impact anything?
does it
Yeah.
impact it? And the guy's like, I do this for actors and I do this for all sorts of people and singers. And, you know, it's really a matter of deciding that you're going to get used to it. He's like, I have mine in right now. And I'm like, okay.
Oh.
It was funny, but I went to like 2 different dentists to be sure that my teeth weren't going to fall out.
Mm-hmm.
Like, I'm just like really obsessed about this because
Yeah.
the irony of like losing a tooth without a cavity would just kill me.
Yeah.
Right? If everything was just all fine and I've never had a cavity, but I lose my bottom teeth because I took out my retainer, like my
That is.
permanent, it would
Yeah.
just,
Yeah.
I guess this is a fear I have. And it's
It's
just
funny. Our
fulfilling
fears, huh?
itself. Yes.
Just give it,
Hey,
given everything.
I I remembered something.
Okay.
Well, I remembered that we haven't shared this yet on the stream. When was the last stream? It was like early August, mid-August,
It
3
was like
weeks
3 weeks
ago.
ago.
I'm a
Yeah.
grandparent.
Oh yes.
I
Yeah.
wasn't sure if I shared that on the last stream, but I think I was about to be a grandparent.
Yeah. I don't think you shared that it was like
I'm officially a
you were
grandparent.
almost grandparent.
Yep.
Grandma Katie.
Yep. I'm gonna go by Nipa, Nepa. And the little
Yeah.
baby is absolutely adorable. And I love him so much. And I'm so excited.
I'm sure. And
Incredibly
this is
like
the
passionate.
first
This is
grandchild?
my first
Oh,
grandchild.
okay. Yeah.
Dylan's first grandchild.
So he's gonna be super spoiled.
Oh, he
Are
is.
they in the same city as you?
Yeah, they're about
Okay.
probably like 45 minutes away.
Yeah. There's nothing like baby therapy when the baby is not yours.
Mhm. It was so great. It was so great. I was
Aw.
holding him this week and he was falling asleep in the nook of my arm. And I just love him so much. It's so
Yeah.
exciting.
Aw.
That's my big news over here.
That is big news. That
Mhm.
is. Congrats.
Thank you.
I
trying.
can't picture you. Like I can, but I can't picture you as a grandma.
Yeah, it's well, I'm 34, so
Yeah.
there's probably a good reason for
But you
that.
have like a old soul. That's what I
Thank
mean.
you.
You know? So I also, before I forget, wanted to update on my COVID
Mhm.
symptoms. So are you feeling you're feeling back to normal
Finally. Like I
finally?
think it was like a week and a half ago that I was still like I had to call out of work a couple weeks ago. So I was
Yes.
still struggling.
Yeah, I
And
took all
then the
last week
last
off.
few days I was like, okay. Like I started cleaning the house today. And it really has not been cleaned since July when I got COVID.
Yeah, since before the conference, probably.
Yep.
Yeah.
Mhm. So how are you feeling?
So I'm better now because normally, like having a conversation like this, I would have had to stop and take my breath a lot.
Mhm.
But what happened was that I guess my symptoms came back. I don't know, but I was getting very short of breath, needing to catch my breath more often. I would sit there and I would try to work for like 20 minutes, 30 minutes, and I would start to feel very warm inside, like I'm overheating. So I'd
Mm.
start to feel kind of like that, and then just nauseous and get a headache. So then I would lay down and I would feel better. So I was like non-functional for a while. And I was just like, my eyes itchy. That's why I keep maybe it's I don't know, maybe it's related. But the symptoms were so bad, they were impacting my ability to work. I was taking 2 to 3 naps a day, which a nap for me is normal,
Wow.
but two
Yeah,
to three a day, and I can
that's a
still
lot.
just keep going is a lot. And I think that, I've been very stressed with work, and I think that the stress with work also was not letting me heal. So it's kind
Yeah.
of like being sick wasn't letting me work, working wasn't letting me get over being sick. And then, my calf muscle tear on top of everything, like I'm not mobile, it's making me more sleepy. So, my mom got concerned about the fluid around the heart because she heard, that some people with who have had COVID get the fluid around their heart. And at that point, I did have a couple episodes of chest pain that were not normal for me, but they also weren't anything that I considered emergent to go get checked. Like I just thought maybe, it's stress, maybe it's my lack of, good sleep or just not feeling
Yeah.
well. So she convinced me to schedule with my cardiologist. and I went to see him the next day, and he listened to my heart. It was normal. He listened to my lungs, and he said that I had some scattered crackles, which are indicative of a little bit of fluid in the lungs. So he told me to take the nebulizer and see if that helps. So I did that, and I have improved. The nebulizer, I was like, why did I think about that? So I was doing it every 6 hours, basically twice a day while I was awake. And since then, it wasn't until maybe like yesterday or 2 days ago. So I've already been taking the nebulizer. I had already taken it for a week, that I finally started to feel like I can sit down and I could play Xbox. I haven't even played because I was just so sleepy. The only thing I could do was just like play a game on my phone for the whole time. Because like the big screens were getting to me. So it's pretty cool because UT Health, like the system that I go to, they have a COVID center. So they specialize, like they have all these specialists who know about COVID and research it and stuff. So I had seen a pulmonologist there last year after my first COVID infection, and they had ordered an X-ray and pulmonary function test. And I never got them because life,
Yeah.
And so I was kind of regretting it because I was like, I don't have a baseline anymore. But she was able to see a chest CT that I had and confirm I had no disease from the first COVID.
Good.
So, I scheduled with the pulmonologist. She doesn't think I have any lung disease. She thinks it's just, residual stuff from the COVID. She didn't hear any crackles or anything. So nebulizer for sure helped with my symptoms. So she's ordering again the pulmonary function tests, and then some labs, some thyroid and cortisol labs to check my adrenal gland, just to see why I'm so sleepy, like more than usual. Because it's not tired. I'm not like body fatigued. I'm just drowsy. Like I just want to close my eyes and knock out. So she also referred me to their PM&R doctor. It was like a pulmonary medicine and rehab doctor, not pulmonary, physical medicine. And I'm not good with acronyms. So this doctor is part of their COVID center, and he actually helps patients like rehab back to their functioning after dealing with COVID. So I'm really excited.
Good. That is very exciting.
Doctor. Yeah. And then I have another one with the infectious disease doctor at the end of this month. And he's like the head guy. Like he's the one that gives all of UT Health the updates on COVID and his recommendations. And he does research on COVID. So I'm going to meet him at the end of this month too. So I'm very excited to be, in the vicinity of all these people. Now that I'm feeling better too. So yeah, it's been a rough 3 weeks since the last time that we were together for me.
Yeah.
A lot has happened. I think for both of us. How's work going for you?
It's going good. Just like I also I started an art business last weekend. So that's been
commissions?
Yes, I'm open for commissions.
And you just said like literally 3 weeks ago you didn't want to do commissions.
But here I am.
That's how it goes.
And I am enjoying it. I am enjoying the commissions.
Do you have like a specific type of art
usually
you're doing for the commissions?
I'm doing pet portraits. I've done one like toddler portrait, but I'm mostly doing pet portraits. And you can find all my stuff about how to order a commission. Here's a little plug at sillybugstudios.com.
Sillybugstudios.com.
I set up a website.
Are you going to make an Instagram?
I have reserved Instagram, Twitch. I already have a YouTube channel with a couple like time-lapse videos and a short that is sped up like 57,000 times of the speed.
Yeah, I love watching the art videos that are just like that.
Yeah? Okay,
yes.
Well, my channel is for you.
Yeah. Oh, yeah. I have it on the Google, so I can on the Google.
So I reserved like all the social media. I need to touch base with you about Instagram because I have no idea how to use Instagram.
Okay.
But at this point, I just reserved it so nobody else can have that Instagram.
Yes. I'm glad it was available.
Me
I'm happy
too.
to
All
help
the
you
stuff
with
was.
all things Twitch as well. I know you have at this too. You
Yep.
probably might know more than me.
I don't know.
He seemed more on top of it. Very
He
chill.
was
I'm
really
always
on top
like
of it. I
stressed
really
every
missed doing
stream.
this. I love your streams too, though.
Thank you. I know. And that's why I haven't streamed in a long time because I have just been so tired. The last time I just played no stream with my friend. I'm talking, I'm playing. I was absolutely drained because of my symptoms. So I did a test last night. I played with my friend. We played till like 3 a.m. And I feel fine. So I think I'm going to stream again soon.
Awesome. I'll be on the lookout for it.
Yes. I need to finish Tears of the Kingdom.
I have not started it. I told myself, because summer is really, really beautiful here in Seattle. So I told myself I would not play any video games until the cooler, wetter weather.
Yeah. Sweater weather.
Yep.
I think that's what Brent said about playing video games. He's going to definitely play more in the winter. So he'll be inside.
Seasonal activity. But I have not played. I remember I did finish Breath of the Wild in time for Tears of the Kingdom.
That was such a beautiful game.
Didn't Silk Song also come out, or is that still
which one?
Silk Song? It's the sequel to Hollow Knight.
I know neither of those games.
I'm glad I don't know, because I would have had a really hard time ignoring that one during the summer. I really, really loved Hollow Knight.
What type of game are they?
It's what do they call it? Like a Metroidvania or something. It's like a platformer, but bigger and fancier, like Ori. I don't know. It's beautiful. That's what it is. It's totally beautiful.
Oh, I'm trying to branch out on video games, but it's so hard for me. Like, I just miss the Blockbuster days where I could go rent one, see if I like it, and then play it. Like now you have to buy a game and you're not even sure if you're gonna like it.
Is that what they're doing with the do they have subscriptions or whatever where you have like unlimited?
I know that they have the PC and Xbox Game Pass.
Okay.
But I don't know about other. I mean, if anybody knows, please just tell me.
Please tell us in the chat.
Yeah.
Yeah.
Because it's rough buying all these games. Not even sure. That's why I just stick to Call of Duty because it's the same concept. I know I like that. And so,
it's hard to branch out when you don't.
It is. I did download a game. It was on sale. What is it called? Oh, I don't have the shortcut here. I downloaded a scary one for October to stream. Ooh. It's called Night Security.
Oh, is that? I think I've seen that before.
Maybe.
I feel like I've seen that before. It kind of maybe it's just reminiscent of Five Nights at Freddy's.
I think it's kind of like that.
Okay.
The movie looks good.
Does it?
Yeah. Have you seen the trailer?
Mm-mm.
Did you know that they're making one?
Nope.
Oh, that's fun. Yeah, it comes out in October. And the Taylor Swift Eras Tour.
What? Oh yeah. You know what I would stream with you? Like if you ever were like, I want somebody to stream a crazy game with me that has no idea how to stream video games. Left 4 Dead. Did you ever play that on Xbox?
I did not.
Oh my gosh. That's so much fun. I don't think they have any newer versions. But it's a very like high speed zombie game. And oh man, we have to play this. I'm so excited.
Okay. We could, if you get your Twitch, yeah, we could do that.
Yeah. I would do that with you. I would 100%.
Okay.
I would 100% learn how to stream on Xbox.
It's super easy.
Left 4 Dead with you.
Directly from Xbox.
Okay.
Yeah. Okay. Yay.
I'm excited.
Look at us. We're branching out and doing all these things.
And you might like it because it is a first person shooter.
Okay.
But it's just so much fun.
Yeah.
I don't know. I'm so excited. Come fall.
I love fall. I really truly come alive in the fall.
Yeah, I really like fall too.
It has been way too hot here. I don't know how it's been there, but
not as hot as Texas. I can't even come close to that in Seattle.
Oh my goodness, I need a shape. I just saw. My mom always gets on me. I feel like
I grew out my armpit hair during COVID, during like the pandemic. early days of the pandemic. I was like, you know what? I'm going to use this opportunity. I'm going to see what it's like. And I loved it.
Really?
Yeah.
I can't. I hate hair.
I
Like
thought I
on
did.
me.
And then I really liked
Yeah.
it. And it was hard to start shaving it again once I started traveling for work. I was like, I know it's not really unprofessional because
Yeah.
it's a personal decision, but it really felt like unprofessional. So I started shaving it again.
Yeah.
It was awesome though. I'll send you a picture.
Just like
I have a
freeing.
picture of
Oh
like
my
me
God.
with like a huge smile on my face and my arm up, and I'm like looking at my it was hilarious. Early days of COVID, they were a lot of fun.
Yeah.
In some
Early
ways.
days.
I mean, I say that I shouldn't say that. They weren't a lot of fun, but there were a lot of things about being home all the time.
Well, I
able
think,
to explore.
yeah. And I think it's just kind of like work and the world shutting down a little bit. It was like, even though it was very devastating, it was still like you kind of just had time to literally stop and smell the roses,
Yeah.
you know? Because now it's just like I'm struggling with work and like being able to do other things besides that. So I'm hoping that soon I can kind of slow down with work and then pick up some of these other, pick up streaming more, pick up more content for my VEDS pages. I bought these little microphones so I can have little, spice up my skits.
Awesome.
Also, my plug is in next month, we are hosting our annual VEDS golf tournament in El Paso, my hometown. It basically raises funds for the VEDS collaborative study. And if you guys are interested in donating or golfing or volunteering, you can find the information on my VEDS pages. I haven't posted it yet, but I will.
Awesome. Awesome. What day?
I actually have a site for that now. It is October 13th.
Okay.
Yes. Fantastic. So October 13th in El Paso. We accept donations from afar too, that if you just want to donate to research and support the cause. But we're pretty excited. The golf tournament is so fun.
Yeah. I haven't been. I thought about going and then I have like other travel and
I know. It's just October is crazy.
Yeah.
I have 2 weddings following the golf tournament. Like it's golf tournament and the wedding, and then the next weekend's wedding. So October is going to be crazy.
We might not be streaming in October, I don't think.
No?
Well, I'll be in Hawaii the first part of October.
Oh.
Yep. And then you have a golf tournament, and then I have a wedding, and you have a wedding. It sounds like we might be skipping October.
Yeah.
Yeah.
Okay. Well, we can come back.
We'll find another weird day.
I know. Well, we can reconvene and talk about our weddings and the golf tournament. Oh, friend, it was so fun.
It was so fun. I think I'm gonna end the stream. I think it's
thank you to everybody, for joining us today. And just listening to us ramble and be very ADD today.
We were very ADD today.
And the funny thing is, I hadn't even had coffee yet. Like I've just been like
sitting there, like consumed.
It is, yeah. I think I'm excited because my dad's coming in today too, so I'm gonna have both of my parents this weekend.
Awesome.
So
that's so awesome.
Yeah,
I love that. Tell him I said hi.
I will. The mad dog.
I always forget how to stop this. Bye, everybody. Great to see you.
Bye. We'll see you November, I guess.
Yes, November.
Just keep an eye on social media.